thank you for everyone joining us today. And in this very special occasion of the International Pathology Day, we are very much honored by having Professor Dame Sally Davies with us today with her amazing experience. And I'm sure everyone of us we will learn a lot from her. So I'll crack on straight and welcome Dame Sally. And thank you for your time today. Much appreciated. I'll start by your lecture in the Royal College of Pathologists Diamond Jubilee. It was wonderful that you were able to give our RC-Path Diamond Jubilee lecture. And at that time, you told us how you got the United Nations on board with this issue of antimicrobial resistance, which I refer to through this talk as AMR. Could you give us a bit of a background to how you got them to take this up?
Thank you very much, and it's wonderful to be here with my former college and you, Noha. So it would be really bad if it was me that did this. This is, of course, the British government for whom I work, but all our work on AMR brings in the Department of Health, who hold the policy lead, and our Foreign Office, Foreign and Commonwealth Office, who do the diplomacy and who happen to have an absolutely wonderful network with the dreadful name or fun name, the SIN Network, the Science and Innovation Network, all around the world, who also help. So in 2016, we managed to get a high-level meeting at the UN General Assembly with the support, I have to say, of the Netherlands, Germany, and Sweden, and it was our diplomats who did it. What is a high-level meeting? It's when, during that week of the UN General Assembly, affectionately known as UNGA, in New York, the third week of September, the heads of state are in town, and there's a few one-day meetings on a special topic. And in the past, in health, we'd had TB, we'd had, I should know, shouldn't I? Obesity on the day before, and HIV. So going for AMR, pushed by those of us from Europe who felt strongly, was really important. And what we found, to no surprise, was people weren't particularly interested in it. They weren't aware of it. They weren't particularly interested. We managed to rev it up a bit because the then Prime Minister Cameron allowed me to commission on his behalf an independent review that looked at the economics. But we didn't really know how big the problem was. And we've been working at it ever since. This year, in September, on the 26th, we had a second high-level meeting. And wow, there was a big change. All the countries now are aware. They're aware of the problem. They're aware of the need to write national action plans, that those need funding. And thanks to work from the Institute of Health Metrics and Evaluation, we have some good burden of disease data. It was a big success, this high-level meeting, for multilateralism. It's very worrying that a number of countries don't want to work in the multilateral system, whereas we from Britain do believe in it. And this showed it can really work. Our Foreign Secretary came and delivered the UK's speech and talked about how we will work from Britain. And I know there's roles here for the Royal College of Pathologists with the Global South and others. We got some real wins out of it in commitments on financing for low and middle income countries, and something I've been fighting for since about 2017, the agreement to establish an independent science panel to advise countries on the evidence base on AMR, which I believe can then lead through to global targets. A bit like in climate, we have the 1.5% global target and the IPCC. So there we are, a success.
It is amazing to hear all this, Sally. I mean, very impressive, and it was a big hurdle to pass from 2016 to this year. If I can ask you to tell us about the high-level meeting, and you highlighted how it went, and what the outcomes mean for pathologists.
So what we need to contain AMR is appropriate use of antibiotics in humans and animals. We all know that. But we're not going to do that effectively if we don't have access to the antibiotics and we don't have diagnostic tests. So pathologists are central to all of this because you run the laboratories. We as pathologists advise on the results, and you keep an eye on trends. You're able to say this antibiotic doesn't work, and from the community pneumonias are this bug and you need this antibiotic, and to really provide that advice when you've got the diagnostic labs. The sad thing is that we know in the global south how poor the laboratories are. And it's really tragic. We from Britain, using overseas development aid, have been able, through the Fleming Fund, to assist 25 countries develop their laboratories. But there's a lot of work to do. And pathologists are always at the center of this, helping with diagnostics, helping with advice, and really making sure that people understand the guidelines and the evidence.
Thank you. No, I think it's really good to hear how putting the pathology work under the spotlight and in the big picture how valuable the work we do in pathology is in relation to the whole global health, particularly AMR. I'll go to my next question. What are the next steps now that the high-level meeting is over? What progress need to happen before the next one in 2029?
Well, clearly the most important thing is not to lose momentum. We've got the momentum with the high-level meeting and a number of things that went before. We from Britain took a musical from Scotland to New York that played off Broadway for 4 weeks about the life of Fleming and AMR, and that helped raise public awareness and everything. But we've got to do a lot more than that. The Global Leaders Group, on which I'm honoured to be a member, benefits from big political leadership, and I hope we can keep that going and recruit other big-hitting politicians. And I count as an AMR ambassador. Sweden has an AMR ambassador. Germany has an AMR ambassador. Saudi is looking at one. We need to try and get this feeling of working together. No one's safe until we all are. But moving on the specifics, this independent science panel, the quadripartite, which is the coming together of WHO, Food and Agriculture Organization, the World Organization for Animal Health, and the UN Environment Programme, that's the quadripartite. They have to do a consultation on which I'm honoured to advise them, and then set it up. We from Britain hope that this will be established beside the IPCC in Nairobi with a shared secretariat of the Quad, but actually UNEP leading. We've got a couple of targets out of the high-level meeting political declaration, reducing deaths from AMR by 10%, and a target for £100 million financing. That's going to need hard work on both of those, though we from Britain are doing our work, and we need to see these as catalyzers to keep governments and the UN system going. But we've really got to bring in other UN organizations and support countries to put in place their own national action plans and make it work. We've agreed another high-level meeting in 2029, and I don't want people going to that, repeating my speeches, telling the world it's time to act and stop talking, just get on with it. I want us to have moved forward and be saving lives, and pathologists will be central to this.
Mm-hmm. Thank you. Yeah, it's good to see how the amount of work at the background that we are not aware of those international connections and collaboration, and good to see how this is important for things to materialize. I'll go to my next question. I mean, a lot of people were rightly pleased to see a big focus on equitable access to antibiotics, diagnostics, and vaccines in the outcome document. How do you envisage that being realized?
Thank you. Terrifically important, whether it's about training and capacity development or it's about finance. But the British view, which I absolutely subscribe to, is that any action needs to be country owned and country led. We can't impose anything, and we've got to put fairness at the heart of everything we do. Our Foreign Office, for us, are developing a new program to improve antibiotic access in some countries across Africa to see what they can learn that they can share with others. And we're listening to countries about their specific challenges, working with the African Union, the African CDC, and of course, WHO Africa. There's a lot of work to be done, and professional societies such as ours, the Royal College of Pathologists, has a big role to play in reaching out on a lot of this. And maybe one of the better side effects of COVID is the ability to now link up digitally and really have conversations, training and sharing so much more easily as today. Thank you.
Totally agree with that. I think we've seen a lot of changes through COVID of how bad COVID was, but the good things that we managed to develop out of COVID has definitely benefited in many aspects. So how do you think do we bridge what is happening at political level and the work the pathologists are doing?
Well, my ask of you is to do your jobs because you do it really well and it's central to what we're doing. We need to learn and share together, and we need pathologists learning and sharing across the world. And remember, policy is only good if it's informed by the evidence and the science and the practicalities on the front line. I remember that from when I worked in a district general hospital. And pathologists can help inform best practice, which then informs what other countries can do and how they can learn from us. One of the things I'm very proud of is our new death certification programme for England and Wales that became law at the beginning of April, where we have medical examiners and they will look, did the person die with or of infection? And if they did, was the AMR present? Well, how could the medical examiners do that if they're not trained? And you, the Royal College of Pathology, have made a training module, and it's fantastic. That shows the central role that you as a college and you in your laboratories play. And I want to thank you for all that hard work.
We're really pleased to hear this from you, Sally, and much appreciated. I think lots of college fellows and members at the background and staff are doing amazing work, and we definitely happy with this progress. My next question: how is the UK working with other countries around the world to tackle AMR? You've touched on a few things, but we would like to hear more from you on this front.
So at the national level, we work through the Fleming Fund. So far, we've spent 280 million, which is a lot of money, upgrading 279 laboratories. Sounds as if it costs $1 million per laboratory, but it doesn't. We've given state-of-the-art equipment, systems, and training. And that's seen a 520% increase in the number of human health and animal health sites submitting data to their national health repositories, and increase the number of countries reporting data to the WHO GLASS system. Oh. Phenomenal. And just think about how behind those numbers are communities who've seen real and sustainable change. I'm told that through this we've trained 22,715 or something people through country and regional grants. And part of that is the fellows, and we've trained more than 180 fellows in microbiology and epidemiology, along with more than 3,000 healthcare workers on antimicrobial stewardship principles. A lot of that in partnership with our NHS here in the UK. It's all 4 nations. And we've provided equipment and capacity training such that the genomics facility in South Africa pivoted during COVID, and they were the ones that picked up and diagnosed the COVID-19 Omicron variant. So you can see how we're not just helping bacteriology, AMR, virology, we're helping strengthen whole health systems. And one of the bits that we really like is a Commonwealth partnership scheme between pharmacists in the NHS and in the Commonwealth, where both sides have learnt from each other. But we work through the G7 as well. Mm-hmm. You may know about our pull incentives for antibiotic innovation. Our UK pilot was successful and is now being rolled out, standard across all 4 nations. And that's directly influenced the text in an act sitting there, bipartisan, in the US, called the Pasteur Act. Let us hope, as the next president of the US is a germaphobe, he gets it to go through. It's influenced a pilot in Japan and Italy's recent, 2 weeks ago, announcements for a pull model. And we also fund an innovation fund investing in early research, and we've got a recent announcement of 15 new projects on antifungal resistance. And we've been working through that on environment in Argentina, and one of the ones that entertains me, fish jacuzzis in Hong Kong fish farms. So we really do a lot of work at the policy level, but also at the funding and support level, which many of our members from the Royal College of Pathologists join in. And I, again, have to thank all of you.
Thank you. Fish jacuzzi is an interesting one. I'm sure. I mean, this is very good. The number of activities that I'm sure we are on this webinar. It's an international, and people from audience from all around the world are joining, and I'm sure everyone else are working on their heads how to learn more about what you've just outlined and how to take part and contribute and make sure they are on board with those things. Thank you. Now, private sector, what do you think is the role of the private sector, and how can public and private sectors work in partnership?
Well, clearly the private sector is key, just as in climate change, whether it's making sure that they have efficient diagnostic systems and methodologies for all of you. I don't know how many of you were aware that the Longitude Prize was eventually won. It was for a new diagnostic that would assist in reducing AMR, and it was won in the summer by a company that used microfluidics on urine, and the microfluidics catch a bacteria, and then in the different channels, they put down different antibiotics, and they can see if the bacteria grows, it's resistant. If it doesn't, it's sensitive. So they may not know at the end of the hour whether it is what bacteria it is, but they know how to whether there's an infection and how to treat it. So innovation and laboratory equipment, crucial. The pharmaceutical industry, we need to be doing innovation in new diagnostics and new treatments. And in fact, the AMR Action Fund, $1 billion, was set up, shared and funded by all the pharmaceutical industry to help pull through a number of new antibiotics. Meanwhile, they come together in the AMR Industry Alliance to lead on standards, and working with the British Standards Institute, they've developed a kite mark, an ISO, for pollution from antibiotic manufacturing. And now more than 60 companies have had laboratories go through this and get the kite mark that their effluent from the factories is safe. And there are plenty more wanting those BSI certificates of the kite mark. So that's very good. Sorry. And finally, I'd say I've been working with investors because I keep trying to learn from climate and climate activism. And, you know, investors have a big role. And at the beginning of September, we got 80 investors to come together and lay out what they call guardrails for how they will invest in the food chain to reduce antibiotic use and promote appropriate use. And I think that that will have as big an impact as many other things. So the private sector's really beginning to work. I was entertaining Noha before this seminar by the fact that last Thursday I went to a meeting at Windsor Castle of the BMA, and it wasn't the British Medical Association, it was the Bathroom Manufacturers Association from the UK, manufacturers from all around Europe, and the equivalent association from the States. And they agreed, and will put out a declaration called the Windsor Declaration that is bathroom manufacturers, so this is taps and sinks and lavatories and things, they will work to conserve water, to reduce infection and reduce AMR. So the private sector can do things by how they design, how they work, how they invest, how they produce products. So I think they're central, and many of them are stepping up, but more to do.
Absolutely. No, thank you for that. And I think we always hear on the private sector is focused definitely on their profit in the first place, and bringing in the AMR under their agenda of a useful thing that they can engage with is a very important thing. We always hear that the priorities is for cancer and chronic treatment in the manufacturers' pipelines, but seeing this activity in the private sector is very encouraging and assuring.
Can I pick up there on the cancer thing? One of the problems we have in AMR is we don't have a patient face. Since I've started talking about my goddaughter who died of AMR 2 years ago now, that's helped me show I have a patient face on this. But cancer patients are now beginning to work across countries together to become a patient face, because 1 in 4 cancer patients gets a serious infection, and our oncologists are really worried about AMR. So I think you'll begin to find you've got allies among the cancer docs and the cancer community, and that may be a way in to get discussion about what you're doing.
Absolutely, that's very good. Thank you. I'll go to another important point in the land of microbiology and AMR as well, which is the animal and environmental part. So of course, animals and environment are essential too. So as Chief Medical Officer yourself, you famously brought vets and doctors together. Do we need more of that?
We'll always need more of that, and we need to recognize it's not our fault or their fault. We share this together. One of my funniest days as Chief Medical Officer was when the chief exec or the president, I can't remember her role, of the National Farmers Union came to see me, and I said, "Why are you coming to see me? I'm the Chief Medical Officer." And she said, "Because you're singing our praises. Do you know our animal rearing in the UK has reduced use of antibiotics by 59% since 2014? They're doing a fantastic job." Unfortunately, in the high-level meeting, we ended up with the lowest common denominator of asks of the animal sector, but we have the World Organization for Animal Health and Food and Agriculture Organization really working hard on stewardship, infection prevention and control, people looking at what vaccines can be developed and how to make them cheap enough to help. So we have to keep working at it because we're all in this together, and fish farming's in there as well.
Absolutely. I think one of the things that came in as well from COVID is the highlighting more of wastewater testing and interest around this. It wasn't a topical issue before COVID, but that again, environment and its role in the whole picture.
Yes, we're going to see a lot more, I think, sewage testing, both for bacteria with AMR genes and the loose genes. I've been to a lot of meetings. The Wellcome Trust, Novo Nordisk, and the Hong Kong Jockey Club are all, with the Rockefeller Foundation, pushing the need to do much more. So I think we'll see much more.
Excellent. And we have a later presentation from Dr. Well-Amin as well today around this environmental testing. So lots of talks today. My next question. So the new data is showing that AMR could kill 39 million people by 2050, a scary figure. It's terrifying. How can we use that to accelerate urgent actions?
Well, we really need to. It's proved difficult so far, but we've got to keep on trying. I think within that data, there's some very interesting issues of demographic shifts, and it shows what's working. In children under 5, infections are falling, though the AMR percentage is rising among those. Why is it falling? We're improving IPC, we've improved access to water, we've improved the vaccination programs. Where there's real concern is in the over 70s and the vulnerable from cancer or diabetes and everything, where the rate of AMR is just going up and up. So we're going to have to put more investment into data collection and taking action. We've also got some new economic data, and the headlines are pretty catastrophic, that we would lose 150 billion per year for human health and 40 billion per year for animal health by 2050 if we don't take action. But what that data modeled was, if we invest in innovation, new treatments for gram-negatives and healthcare improvements, we could actually add money to our GDPs, 960 billion to the annual GDP, and save more than 10 million lives. So not everyone's going to be salvageable, but with new antibiotics, better treatments, and better food chain security, we could make a big difference. But that means educating people about AMR much, much more. We've got to bring the food ministries and the agriculture ministries into this conversation much more than we've managed. The high-level meeting helped. And we've got to bring in the public. They need to understand what's going on and help.
Absolutely, absolutely. That's very good. The more you spend, the more you save down this route. On that note, Sally, how can we better engage the public on AMR, which is another important part of the game?
Well, it's proved difficult, hasn't it? The classic way of putting it into television and films, we haven't had great success. I mentioned our musical we took to New York. One of the ways that's working is not just going to listen, but every week they have a new community chorus of doctors, pharmacists, science teachers, nurses, scientists there who join in, and they learn about it and take the discussion out. That's fantastic. We also had, and I wish I could show you the video, a wonderful billboard, a massive one in New York, running all through the high-level UNGA week, talking about AMR, showing the number of deaths that happen every minute in the States and things. And I, through a charity I set up in 2020, have been doing in 6 middle-income countries some deliberative polling for the Trinity Challenge, and that has brought in 2,500 people into it. So you can reach out. We're just going to announce in World Antimicrobial Awareness Week the 7 winners of a youth summit competition we had, who have been given seed funding by the Trinity Challenge to develop hand washing and IPC campaigns for their schools. I can tell you also there are a number of films going to come. One that I was looking at the near finished version last night has Brian Cox of Succession, who many of you will recognize, who can do nasty better than most people, being AMR as a drone around the world. It's amazing. But local context matters. So let me just highlight one example. In Tanzania, a young pharmacist, Eric Vant, who's at the moment in Manchester doing a PhD, set up Rollback AMR initiative, arts and drama clubs in schools. He even did a poster campaign with posters on tuk-tuks. He's amazing. We need more local champions working with the schools and the communities.
Very good. Very good. So definitely, it's good to hear some activities happening other places in the world and movies and things. I take it you haven't been offered a role in any of the Hollywood movies or something on that. You never know. You never know. Okay. Next, my next question. So we heard it's brilliant news that Investor Action on AMR has just been announced as a nominee for a City AM Dragon Award, which showcase leadership and commitments to ESG, sustainability and social responsibility. How important are investors in this?
So I mentioned this earlier. I'm absolutely thrilled that there's 80 investors with their, as they call them, guardrails of how to invest in the food chain have been put up for an award. I hope they win it, because that again increases awareness both of the public but the investor community, because we know the investor community has been key in the climate discussion and debate. And we shouldn't forget the role of consumers too. We haven't in Britain focused on that yet, but in the States, they have a US scorecard for fast food restaurants, and it's been a really effective instrument. Chipotle is at the top because they use meat from proper growth facilities where there's appropriate use of antibiotics. In other words, they're only used on sick animals, which we all know is needed. So let's push consumers. Let's keep supporting the investor action. We all have a role.
Absolutely. Thank you. On another note, we learned that you're going to Saudi Arabia in a couple of weeks. And we spoke about this before the meeting as well. And what is the aim of that visit and what you're hoping to achieve?
Well, if you have high-level meetings with objectives and commitments, how do you hold them to account? The ideal would be a conference of the parties like we have in climate. For all it's become a great jamboree, it does mean there's a focus and things move forward and countries want to show they're doing something, and it's a place to trade money and various other things. We haven't got to there yet. Of course, I have hopes that one day we will, but we're having our fourth global ministerial conference on AMR in Saudi. And it's the beginning of this, of sharing what countries are doing, what works, what doesn't work, talking about the agenda that comes out of the declaration and saying who's going to do what and where and how, and moving it forwards. Meanwhile, announcing another country that will do a global ministerial in 2 years. And so we plan to have a ministerial that is helpful and action-oriented every 2 years around the world to try and move things forward. Not easy and very light touch compared with COP, but a way to enable learning and reporting between countries.
Very good. This is very promising, and I'm sure lots of work and lots of effort, and hope there'll be a successful meeting. If I can ask you, what is your call to action for our audience?
Well, I would say that each and every person across the world has a role to play, whether it's preventing infections by proper IPC or making sure that we practice personal stewardship, listen to the doctor or nurse, and don't take antibiotics for viral infections. But of course, pathologists have a particular role. So doing your job well, but going out into the hospital, into the community, saying, we've got this level of AMR, you're going to have to reduce it. These are the ways you can take an action on it. So educating other health professionals, working One Health if you possibly can, and reaching out into our local communities. But then with our own prestigious Royal College, seeing how, as today, we can reach out to support other countries who don't have all the facilities and background we have,